Thanks, Jerome. As the Premier said, it's clear we're not in a position to release restrictions today. We do have more than 12,000 primary close contacts who are currently quarantining, and that number's growing every day. We've got almost 300 public exposure sites, that number also growing on a daily basis. And then the 5 unlinked cases today, which are always of concern. You can manage them, you can manage their close contacts, but they've gotten their infection from someone, from somewhere, and if that's not identified yet, then there's the risk of further people being exposed, and we're not able to manage that, to control those cases if we don't know where they are, and so that's a particular concern. That's a very different situation to what we saw in regional Victoria when we lifted restrictions for regional Vic. I'm sure that Melbourne will get to that in time, but we are not in that position as of today. We also know that for essential reasons, for authorised workers, there is movement across Melbourne metropolitan area, and so an issue anywhere in Melbourne is potentially an issue anywhere. We've got exposure sites that extend across the Melbourne metropolitan region. We've got cases that are not just confined to a couple of suburbs in the north and west. They really are quite extensively spread. I am confident we're getting ahead of it. With 14 out of the 15 linked cases today already with their entire quarantine period, their entire infectious period in quarantine is a really good sign, and I hope that continues. Jerome did speak about Melton. Our epidemiologists are working really hard to try and identify if we can link that particular family in terms of the shopping precinct or any other likely exposures. When we've got advice that provides that link or a particular exposure site that transmissions occurred at, we'll provide that as soon as we possibly can. But I also want to call out to the people of Melton, indeed Caroline Springs as well. If you are symptomatic, runny nose, sore throat, headache, fever, aches and pains, if you feel unwell, please get tested. There are busy queues in some places around the west, but look online, have a look at what the waiting times are. The showgrounds in particular has high capacity, so please get tested as soon as you can. That will be the way that we identify new chains of transmission, or indeed any of those chains of transmission that we haven't yet found. When we find them, we can control them. When we can control them, we can end those chains of transmission, and we can release restrictions at the earliest possible time. In Melton, there's also the Djerriwarrh Health Services drive-through, so please bear that in mind, and we'll look to the activity of testing centres in the western suburbs to see how we can best respond to any of those demands. Finally, on border permits, the Premier spoke to the new permits on the border. We don't want any unnecessary restrictions on people in the border communities. We do want to protect them. We want to reduce the risk, and we want to be able to respond appropriately should any incursion into the border communities occur. We want them to go about their business safely. That is the key element here. The border permits don't change any of the reasons to leave home or the freedom to move across the border, but it does replace the ID check, and it means that the data that goes into Service Victoria, the same data that we get for every green zone, red zone, orange zone entry into Victoria, will apply to the border permit holders as well. And if there is an incursion, if we need to contact people, if we need to understand how people have moved in and out of Victoria, it'll allow us to respond quickly and effectively. And a quick and fast response means that we can get on top of outbreaks and lift restrictions again in the shortest possible time. So, essentially that new permit system, we hope it's not too burdensome. It will apply for a 14-day period, but it does mean that we can respond to any of those threats that, as the Premier pointed out, are continuing north of the border and will unfortunately remain a threat to the border communities for some time to come. Thank you.